Hi everyone, I'm Ali GREYMOND. Today I'm answering questions that you left below my Instagram post asking you to ask questions if you have any about OCD recovery. First question is, can you feel totally normal for the most day with barely any thoughts and then at the end of the day be bombarded with the thoughts? Usually, what happens is the person will have triggers, obviously, trigger situations or trigger times of the day. For some people, the morning is the worst. For some people, the end of the day is the worst. This just depends on the specifics of the person. But now you know this pattern, so right before you usually feel like things are about to get bad, like even note the time because it usually is pretty similar time wise. So okay, so say for example around 8 p.m. Things get bad, so at this time be really focused, maybe watch an OCD video or two, or get you however you can get yourself in the zone that the thoughts are going to come in, there's nothing I can do about it, but I need to push through and do the recovery work. Otherwise, it's not going to go good. So you're really pushing through on that and you're prepared. I equate it to if somebody was to break into your house in the middle of the night, you would have a lot better chance of survival, you know, if you knew that they were coming rather than it comes suddenly and you're unprepared, right? So it's kind of the same idea, it's pushing through when things get tough and being prepared to push through, you know. This also goes for any stress situations because stress also makes OCD worse. So if you feel like you have something coming up in your life that is stressful, also prepare for more thoughts to come in because most likely they will. If you have physical OCD, when they say thoughts, just replace it with, or just to do compulsions, really the same thing. And again, reacting correctly. So meaning no reaction, disregarding, not analyzing, not checking, not doing, not getting reassurance, not googling, like giving it nothing and living parallel to it. When you do that, obviously the thoughts are not just going to magically go away, they're still going to be there, so you're living parallel to them, but you're not feeding them. And in this way you're showing your brain that this is not relevant, this is not scary, and you're basically giving a signal to stop sending me these thoughts because they're not relevant to my life. And eventually your brain will let go little by little. So it's like, sometimes, especially young people, when I talk to them, they will often say, well, I've been, doing the work for a day, Ali. Why aren't the thoughts going away? I'm like, okay, it's going to take longer than a day. So being patient, being prepared that it will be there for a few months. I say that realistically, 6 months of actual doing the work. A lot of times again people say, well, I've been doing this for many, many months. Well, you may have been doing it, but you haven't been doing it, with a real push and real kind of um, effort. You've been suffering, but in terms of, if we're honest with ourselves, how much you're actually pushing. So from when you start pushing, when you feel like your brain is switching, and again, if you want to know more about the brain switching, the best video to watch is Stages of Recovery. I believe there's 3 videos with 3 separate stages, so you can see where you are. And this is just shows you how OCD progresses and what happens in each stage. So how do you know you're recovering? How do you know the brain is switching? So, anyways, but that's a kind of sidetracking. Um, so you need to be focused and you need to be plowing through for about 6 months. I would say in the first 2, 3 months, you're going to feel probably the most improvement. And then the second part, it's just kind of like the thoughts are almost not there, but they're there every once in a while. And they kind of just, they go away little by little, like fully, right? The brain seems to be. Uh, um, at first it's hard, then it seems to be easier for the brain to let go from, say, 70% a day per day worrying about OCD, right? Out of the whole day, um, to about maybe 30. That transition from 70 to 30. So, but when you get to, I only have OCD about 30% of the day that it's bothering me, to zero, that's like a longer situation. So that can last months. And also, don't get scared when that happens, because sometimes people are like, well, why isn't it going away fully? And it's at the end it's a little bit slower, maybe because people don't push as much, maybe that's just how the brain works. But that's what I see, kind of, you know with everybody. um, but be careful that this doesn't become a theme, because if you start to worry why are the thoughts still coming in every once in a while, and will they always come in every once in a while, then now you're getting a theme about OCD recovery, so now you're obsessing about that. So just kind of a side note, I completely sidetracked from the question, I realize that. I'm getting back on track now. So next question is, would you say that the best thing to do in the meantime or of get oh okay would you say that the best thing to do in the meantime of getting professional help is to refuse rumination, compulsions, and avoidance as much as possible? Absolutely. you know I mean, in terms of like seeing any kind of professional who helps you with OCD, what is it going to come down to? It's going to come down to you doing the recovery work. So you need to be pushing with or without help. If you can't afford help, if you feel like maybe you don't want to, for whatever reason you don't want to seek professional help, do it at home. Like I say, 5% a day, 5% less. Creating an hour for yourself where you're going to refuse analyzing and you're really going to monitor yourself no matter what, and keeping that hour. That first hour didn't work out, try again until you get that hour down. Next day, an hour and a half. And it's like, if you're not going to push yourself, no professional on planet Earth can push you. Do you know what I mean? It's, like when I talk to people, I can tell you within the first 5 minutes of talking to somebody if they're going to recover in the near future or not. Because you can sense, if a person, and I have another video on that, by the way, who recovers and who doesn't, I called it. Um, because it's, you can just tell, if you talk to a person and they're like, you know what, Ali, you just tell me the details of what I need to do, correct the behaviors, how we're going to do this, I'm ready, I'm going for it, right? Versus a person who's like, I can't, I won't, maybe tomorrow, maybe in a week from now, I'm not quite ready. Like, it doesn't take a rocket scientist to figure out which one of the two people is going to recover real quick. So it starts with an attitude, and when you have the right attitude and you're plowing forward, all professionals need to do is to correct it, because a lot of the times I find that the person doesn't realize how much compulsions they're doing, so they're addressing the main ones, but there's a lot of minor stuff they're missing, or avoidance behaviors that they're missing, or maybe their thinking is not exactly how it should be. Details, like nuances. But generally, it will still come down to pushing. And if you don't push, you're just not going to recover. You know what I mean? And if you will push, you will absolutely recover. And that's just what it comes down to, with the thoughts, with the compulsions, with the avoidances. Also, while you're doing all of that, really with OCD, the big thing is just disregarding, right? So when you're disregarding OCD thoughts, that means you're actually focusing on real life as much as possible. So being really centered and really focused on just the day to day stuff, as much as you possibly can be, because your mind is still trying to always get back to OCD, right? So you're always fighting this battle. But it's just doing the best you can every day. Like I say, you try 5% more each day than the previous day, and in 20 days you have done 100%. you know and it's like, this is kind of like a more you know um kind of overall statement, right? Embellished statement, because it's not actually 20 straight days. There's going to be setbacks. There's going to be days where you just stayed at zero. But even if we take the setbacks, we take the days that you stayed at zero, what's going to be like 20, instead of 20 days, 30 days, 40 days? That's still, compared to how much most people suffer with OCD, it's like nothing, because it takes over 10 years right now, according to statistics, to even get diagnosed with OCD. So most people have suffered for a long, long time before they even, get to the stage of um, of starting recovery. So, I always say to clients, don't you think you've suffered enough? Let's just start to do the work right now. Really, really start to do the work right now, and then you start to see results. It's not magic, it's just being focused, understanding where the mistakes are happening. And again, like just like the previous question, it could be certain times a day, certain triggers that make you fall apart. So working those triggers out, being prepared for those times, those kinds of things will help you push through. But it's about the everyday, it really is. Next question. Even though you're fully recovered, do you ever get thoughts return or relapse if it's small? Okay, so I do not get OCD thoughts, and the reason being is because my OCD thoughts were uh, of the more outrageous kind, let's say. Um, so basically, there's two types of OCD thoughts. Um, there's OCD thoughts that are way outrageous. What if I was driving and killed somebody and forgot? Uh, what if out of nowhere something bad is going to happen, right? Those are kind of the more or magical thinking OCD, or numbers, or like those kinds of things, right? Um, Now, compare those kinds of thoughts. Those will not come back to you. Now, what if the person has an OCD obsession with finances? Are you truly going to tell me you're never going to worry about finances for the rest of your life after you recover from OCD? Right? So, or relationship, you're never going to be concerned about your relationship ever in your life, or religion, if you're a religious person, right? You're going to be concerned about religion because religion is important to you. But if you have that type of OCD, it's the level. So you will achieve the same level that everybody else who has never had OCD experiences. So say 1 out of 10, 2 out of 10, maybe if something is going on, as opposed to 10 out of 10, which is clearly OCD territory. So this is kind of depends on your type of OCD. But the point is that you will become like everyone else when it comes to the level of anxiety related to these thoughts, you know? Next question is, hi Ali, I have a mix of all OCD types, but mostly pure O. I can just ignore the thoughts and prevent response when the thought comes in. I've tried imaginal exposure recently and it's worked a bit. I'm still getting the thought, but less anxiety. How should I do ERP? Other ways for pure O. For pure O, I find that there's a lot of avoidances that also happen. Um, so with avoidances, pinpointing what exactly you're avoiding, pinpointing any triggers and working more with those triggers. Um, for imaginal exposure, to be honest with you, I don't find imaginal exposure to be very helpful. It like you said, just maybe just a little bit. I do find it, like, for example, if you have a violent OCD, not avoiding watching the news, not avoiding watching violent movies, that doesn't mean you have to immerse yourself to an extreme degree. That this depends kind of on who you ask. I don't like to do things to the extreme uh, with clients. I like to remain kind of in the normalcy of what the person would do regularly. So for example, if the person has harm OCD, but they actually like, those kinds of like scary movies, horror movies, then they should watch them a lot, right? But if the person is just not into it, like that's not something that they would normally watch, that's something that they have no interest in, you know then we should watch them a little bit just to do some exposure, but so they're not scared if they happen to see one. Or watching the news a little bit, just so they're not scared again if the news comes on, but not immersing yourself if this is not your natural state. But this is just how I do things. If you want to be more aggressive, then doing more exposures with those kinds of things. I'm just using harm OCD as an example because that's just a common one for Puro. Um, so basically, how much you are allowing the anxiety to go up, the anxiety will go up, it will stay there, and it will calm down. But I find that if you don't feel like the imaginal exposure is intense enough, try to do something with, like, like watching the news or things like that, which triggers your themes, or watching shows that trigger your themes. Next question is, should I do ERP for obsession all at once or one per day? Oh, sorry. They corrected themselves. Should I do ERP for all obsessions at once or just one per day? Okay, this is a very important question. I probably should make a note and do a separate question on this so people don't miss it in the Q&A. Um, you should do for all of them at once, because if you just target one per day, this is completely speaking from experience of working with clients. It's like if you have a bucket and the bucket has many holes and the water is leaking out of all the holes, while we're trying to plug one up, another one appears. Do you know what I mean? It's just like it's because we're focusing the attention of getting rid of one, and then the other ones are getting worse. New ones come up, so it's just not good. You know, so I don't recommend doing it that way. I would say 5% less per day. So say for example, say you have a compulsion of checking the door, and you check the door usually say 3 times, so you're going to check twice. You usually basically you're you don't have to stick to exactly 5%, but I'm just saying just cut it down where you can. Some places, if you can cut down more, by all means. Why are you going to suffer longer if you don't have to, if you can get out of this faster, right? But at least do something in each category. Next question is, how do you do ERP for sensory motor OCD? I feel the urge to swallow. The more I swallow, the more I need to. I try to resist and not swallow, but it's been going on. So not allowing yourself to analyze and swallowing in whatever which way. So you're not following a pattern. So you're not swallowing at all. You're not swallowing too much. You're just saying like whatever, swallowing doesn't matter. So I'm going to focus on some trying physically try to see yourself shifting the attention away from that area, and doing something like around the house, whatever it is that you're doing, working, and but away from the swallowing as much as possible, and having the attitude of it doesn't matter even though you feel like it does. Not looking stuff up again, not analyzing, just like whatever, I swallow how I swallow. And if it tells you specifically, oh, this would be the wrong way to swallow, do it that way on purpose. you know it's hard to advise sensory motor OCD because I need to kind of know the details, but this is just a very general advice. So basically, whatever scenarios it tells you, if you don't do this, something bad is going to happen. You're not buying into it, and it's a lot of times people find sensory motor very challenging because that's an actual physical symptoms, but it's not different than any other type of OCD. When I was in elementary school, I had a teacher everyone, even my mom, disliked as a person. My mother even told me to be careful of him. That was when I developed an obsession of the image or the idea of him. Nothing happened though. I finished elementary school and I still get the image thought. How do I do ERP if I never see the teacher again? Does imaginal exposure work? In this case, I would use imaginal exposure, and whatever it tells you, just face it head on, right? Like whatever OCD tells you, and agree with it in a sarcastic way, like, oh yeah, yeah, I remember the teacher. Oh yeah, and bring it up, I swear, like a million times a day, whatever, as many times as you possibly can do in your in your life, like how much time you can devote to it. Just flood yourself with the image of this person until your brain's like, okay, I give up, but and then when you do this, so that's the exposure, and then you need to prevent the response of fear. So your response will be like, so what, just another person, just another teacher. Yeah, everybody had a bad opinion of him, whatever, moving on. And do this over and over and over again. And you won't feel right about doing it. It won't feel like you're saying the right things. You won't get the feeling. Never, like guys, across the board, never chase the feeling. However you feel is controlled by OCD. Disregard, don't react, just push through. The more you push through, you will see the easier this gets. Next question is, sometimes I get obsessed with a song or an artist that I listen to them so much compulsively, and I even end up daydreaming different situations as if I was that artist and performing that song. What would you suggest me to do? I would suggest not allowing yourself to think or listen uh, um, uh, like any specific artist, any specific song, more than certain amount of times. So you set a limit for yourself. So say each song you're gonna only listen to, say, 3 times, and you're only gonna listen to, say, 3 songs per artist. And anytime you're thinking about an artist, you're not, because this is just clearly a compulsion. So not allowing yourself, setting limits, and then as you get used to it, then you can reduce the limits, and once it's gone, then you can listen however you want. But again, make sure it's fully gone. Like once it's gone, I mean, not like it's gone this week and next week I can start doing whatever I was doing before. I mean, like in 6 months, just to be clear. um Is it a possibility to develop borderline personality disorder after having severe OCD? With OCD, I'm better, but on the other hand, I can feel that my emotions eat me up. I have reactions that I cannot foresee before they happen, and there are days I feel insane. Your obsession is with developing another mental illness. So don't look up anything about any other mental illness, because that's what's going to get you deeper in. So refusing reaction across the board, refusing analyzing, refusing trying to figure out if your symptoms match. This is your compulsion. This is your obsession. This is what's going to make the situation worse. So you can't allow yourself to do that. Next question is, um, how do I manage sexual OCD obsession? Sometimes I feel like I'm losing myself. Uh, See, it's hard because there's no information here, you know? So it's, again, choosing to disregard, choosing not to obsess generally. But, just like any other type of obsession, it can have like so many nuances to it. I don't really know what you mean exactly. So maybe in the next Q&A, if you can. Explain I understand that it's a sensitive topic, but explaining a little more, or asking any like more specific questions would work better. um a while ago you told me not to take the theme about depersonalization. Too bad I already did, analyzing, thinking, and obsessing about it. I wanted to ask you how to properly do compulsions for it. You mean do exposures for it? Like feeling I'm not myself, doubting if I'm someone else. Thank you, Ali. So, okay, depersonalization. You have to understand that depersonalization goes, it's not exactly the correct term, but basically, usually it goes along with another type of OCD, because when you are focused on OCD thoughts, everything else seems less real. You're almost like you're walking through a fog. And when the person starts to experience that state, of being like removed from the world, you feel like there's like a glass wall between you and everyone else. You can't, understand things well. You can't grasp things as fast, all of this kind of stuff. you know when this happens, a lot of the times people start to obsess about a derealization, and then that becomes the main theme. You have to look at it as this is a symptom of OCD, which now has, I guess, become the main theme. So anything to do with that, any thought that has to do with depersonalization, derealization, is off limits. You can't allow yourself to analyze. You're not looking things up. You're not asking other people. You're not comparing how you were before and after. You need to let this die out. The way you let this die out is by not focusing your attention on it, not solving it. You know, it will it, it will go away if you don't feed it. If you do feed it though, it will stay indefinitely. So it's very important not to. I still have quite a few questions. If probably by the time 20 minutes is up, half the people are not listening, so I will put it into the next Q&A, which will be tomorrow. So the part 2 of this video. So if I haven't answered your question, it will be in the second part. Thank you so much for watching. I do daily videos, so if you haven't subscribed, please subscribe. If you would like to do the recovery program, all the information is on youhaveocd.com. Thank you for watching. I'll see you tomorrow.